The human body is an extraordinary biomechanical marvel, yet as we advance in age, the inescapable force of gravity combined with the natural slowing of our physiological processes often leads to a phenomenon that significantly impairs our quality of life, particularly in the lower extremities. As the day progresses, the constant downward pull of gravity orchestrates a relentless accumulation of fluids in the legs, ankles, and feet, creating a state of dependent edema that goes far beyond mere aesthetic swelling. This pooling fluid is not simply water. It is a complex, often toxic soup of metabolic waste products, cellular debris, denatured proteins, and inflammatory cytokines that the body has generated through its daily metabolic activities. When this fluid becomes trapped in the interstitial spaces of the tissues, it creates a hostile microscopic environment that starves surrounding cells of oxygen and essential nutrients, leading to a cascade of chronic inflammation, tissue fibrosis, and the all-too-common nighttime discomfort that plagues so many older adults. The sensation of heavy, aching, or restless legs that intensifies just as one is trying to sleep is a direct consequence of this metabolic stagnation, irritating the peripheral nerves and signaling the brain that the local tissue environment is compromised. To understand how to combat this pervasive issue, we must first deeply understand the intricate workings of the lymphatic system, a vital but historically underappreciated network of vessels, nodes, and organs that serves as the body's primary waste disposal and immune surveillance infrastructure. Unlike the cardiovascular system, which relies on the powerful rhythmic pumping of the heart to propel blood through a closed loop of arteries and veins, the lymphatic system is an open-ended, low-pressure network that is entirely dependent on external forces and intrinsic, microscopic muscle contractions to move fluid against gravity. The initial lymphatic capillaries, located just millimeters beneath the surface of the skin, are uniquely constructed with overlapping endothelial cells that act as one-way microvalves. When the pressure in the tissue spaces rises due to fluid accumulation, anchoring filaments attached to these endothelial cells are pulled taut, swinging the cellular doors open and allowing the protein-rich fluid, now called lymph, to enter the capillary. Once inside, the fluid must be transported upward, traversing a vast network of progressively larger vessels called precollectors and collectors, eventually passing through multiple biological filtration stations known as lymph nodes, before finally being dumped back into the venous circulation near the collarbones. However, as the body ages, the inherent elasticity of the connective tissues diminishes, the structural integrity of the delicate lymphatic valves weakens, and the spontaneous contraction rate of the lymphangines, the functional pumping units of the lymphatic vessels, decreases significantly. This age-related decline in lymphatic pumping capacity means that the system is easily overwhelmed by the volume of fluid pushed into the lower limbs by gravity over a long day of standing or sitting. The resulting interstitial fluid stasis allows large protein molecules to become trapped in the extracellular matrix, which in turn alters the delicate balance of osmotic pressure, drawing even more water out of the blood vessels and into the tissues. If left unaddressed, this protein-rich stagnant fluid begins to undergo a process akin to biological thickening. It transforms from a watery consistency into a more gelatinous state, prompting local fibroblasts to lay down excess collagen in a misguided attempt to fortify the swollen tissue, ultimately leading to irreversible tissue hardening or fibrosis. Furthermore, the accumulation of lactic acid, carbon dioxide, and various pro-inflammatory mediators such as interleukins and tumor necrosis factor alpha in the stagnant pool acts as a chemical irritant to the free nerve endings in the skin and fascia. This chemical irritation is the primary driver of the throbbing pain, nocturnal muscle cramps, and restless leg sensations that severely disrupt the architecture of sleep in the elderly. Sleep, particularly the deep, slow-wave restorative phases, is the critical window during which the body engages in cellular repair, memory consolidation, and the clearing of neurological waste products. When sleep is repeatedly interrupted by the physical discomfort of swollen, inflamed legs, the resulting systemic sleep deprivation triggers a chronic stress response, elevating circulating cortisol levels and shifting the autonomic nervous system into a state of sympathetic dominance. This prolonged sympathetic overdrive further constricts peripheral blood vessels, exacerbating poor circulation, and creates a vicious, self-perpetuating cycle of fluid retention, pain, and sleep loss that rapidly accelerates physical and cognitive decline. Fortunately, This cycle can be broken by mastering the precise, manual interventions necessary to artificially stimulate the sluggish lymphatic system and facilitate the evacuation of these toxic fluids from the legs before bedtime. The practice of manual lymphatic drainage is profoundly different from traditional deep tissue massage, and understanding this distinction is absolutely crucial for success. While deep muscular massage relies on heavy pressure to release tension in the muscle fibers, applying deep pressure to swollen tissues will actually crush the delicate, superficial lymphatic capillaries flat, completely collapsing their internal lumen and halting any fluid uptake. Therefore, the touch required to stimulate lymphatic flow is extraordinarily light, generally requiring no more pressure than the weight of a coin resting on the skin. The goal is not to manipulate the underlying muscle, but rather to gently stretch the skin in specific directions, thereby tugging on those microscopic anchoring filaments to open the endothelial junctions and create a vacuum effect that pulls the stagnant fluid into the lymphatic vessels. The execution of this technique must follow a very specific anatomical sequence, dictated by the physiological reality that one cannot push fluid through a blocked pipe. Therefore, before addressing the visibly swollen lower legs, it is imperative to first clear the proximal pathways, the central drainage stations closer to the heart, to create a low-pressure void into which the lower extremity fluid can flow. The preparation for this nightly ritual should begin with the individual lying comfortably in bed, ideally with the legs slightly elevated on a pillow to enlist gravity as an ally rather than an adversary. The entire sequence is initiated not by touching the legs, but by engaging in deep, diaphragmatic breathing. The diaphragm, the large dome-shaped muscle separating the chest from the abdomen, is the single most powerful driver of central lymphatic circulation. Directly beneath the diaphragm lies the cisterna chyli, a dilated sac at the lower end of the thoracic duct into which all the lymph from the lower half of the body drains. As an individual takes a slow, deep breath in, the diaphragm descends, compressing the abdominal organs and physically squeezing the cisterna chyli, forcing its contents upward into the thoracic duct. Upon exhalation, the diaphragm relaxes upward, creating a negative pressure environment in the abdomen that acts like a powerful biological siphon, drawing fluid up from the groin and legs. Performing 5 to 10 deep, slow, mindful abdominal breaths before even touching the skin is a non-negotiable first step that primes the central pump and fundamentally alters the efficiency of the manual work that follows. Following the activation of the deep abdominal lymphatics, the focus shifts to the inguinal lymph nodes, a dense cluster of filtration stations located in the crease of the groin. Because all the lymphatic fluid from the entire leg must pass through this critical junction, the inguinal nodes must be emptied first. Using the flat pads of the fingers of both hands, the individual applies a series of gentle, stationary, semicircular strokes in the groin crease, directing the stretch of the skin upward toward the navel and slightly inward. The pressure is applied during the upward stretch, followed by a complete release of pressure as the hands return to the starting position. This rhythmic cycle of stretch and release, repeated perhaps 10 to 15 times, mimics the natural intrinsic pulse of the healthy lymphatic system and encourages the lymphangions in the area to increase their contraction frequency. Once the inguinal nodes have been sufficiently stimulated, creating a vital vacuum at the top of the limb, the process moves down to the thigh. To effectively move fluid out of the thigh, the hands are placed on the inner and front surfaces of the upper leg, just above the knee. The technique involves a slow, sweeping upward stretch of the skin, pulling the tissue gently toward the freshly cleared groin area. The hands move progressively downward toward the knee, but the direction of the fluid movement is always guided strictly upward. This paradoxical approach, working down the leg anatomically while pushing the fluid upward mechanically, is a cornerstone principle of decongestive lymphatic therapy, ensuring that the fluid is always being pushed into empty, compliant vessels rather than against a wall of pre-existing congestion. Upon reaching the knee, special attention must be paid to the popliteal lymph nodes, which are nestled in the soft hollow space directly behind the knee joint. These nodes act as the primary collection point for all the fluid draining from the calf and the foot. Using the fingertips, gentle, rhythmic scooping motions are directed upward behind the knee, stimulating these nodes to process and forward the fluid they have accumulated. This action is crucial, as the calf area is typically where the most severe, uncomfortable swelling and toxic stagnation occur. Moving down to the lower leg, the technique requires a careful, enveloping approach. The hands cup the calf muscle, and using a gentle pumping motion, the skin is stretched upward toward the back of the knee. Because the skin over the shin bone is thin and tightly bound, the majority of the fluid movement in the lower leg must be directed around the sides toward the back of the calf, where the larger lymphatic collector vessels are located. The hands methodically work their way from just below the knee down toward the ankle, repeating the upward stretching and releasing motions, meticulously coaxing the accumulated metabolic waste out of the congested interstitial spaces and into the newly opened lymphatic channels. The ankle and the foot, being the furthest points from the heart and the most profoundly affected by the unrelenting pull of gravity, require meticulous and patient manipulation. The areas around the medial and lateral malleoli, the bony prominences on either side of the ankle, are notorious for harboring thick, stagnant fluid that causes painful stiffness and limits joint mobility. Using the thumbs or fingertips, tiny, gentle circles are drawn around these ankle bones, constantly directing the tissue stretch upward toward the calf. On the top of the foot, the skin is exceedingly thin, and the lymphatic capillaries form a dense, delicate web. Extremely light, sweeping strokes from the base of the toes up toward the ankle help to clear the final reservoirs of trapped fluid. This entire manual sequence, which might take 15 to 20 minutes to perform thoroughly on both legs, is not merely a mechanical plumbing exercise. It is a profound physiological intervention that alters the local chemical environment of the tissues. As the protein-rich fluid is manually evacuated from the interstitial spaces, the localized tissue pressure drops significantly. This decompression relieves the mechanical stress on the peripheral nerve endings, immediately dampening the pain signals being sent to the brain and alleviating the restless, twitching sensations that interfere with the onset of sleep. Simultaneously, the removal of the stagnant, hypoxic fluid allows fresh, oxygenated arterial blood to flow more freely into the capillary beds. This influx of oxygen and vital nutrients is essential for cellular respiration and the repair of minor tissue damage that occurs throughout a normal day. Furthermore, as the lymphatic system is manually pumped, the body's immune surveillance is enhanced. The lymph nodes are densely packed with specialized white blood cells, including macrophages and lymphocytes, which are tasked with identifying and destroying pathogens, neutralizing cellular debris, and processing the inflammatory cytokines present in the stagnant fluid. By actively pushing this fluid through the nodal filtration stations, the manual drainage technique accelerates the neutralization of local inflammation, fundamentally shifting the tissue environment from a state of chronic degradation to one of active recovery. The physiological benefits of clearing this toxic fluid before sleep extend far beyond the localized environment of the legs. The human body operates as a deeply interconnected holistic system, and chronic inflammation in the lower extremities exerts a systemic toll. The inflammatory cytokines trapped in the leg tissues can leak back into the general circulation, contributing to low-grade systemic inflammation, which is a recognized driver of cardiovascular disease, cognitive decline, and metabolic dysfunction in the elderly. By actively facilitating the clearance of these local inflammatory mediators before they can become systemically entrenched, nightly lymphatic drainage acts as a powerful preventative health measure. Moreover, the profound relaxation induced by the gentle, rhythmic, and repetitive nature of the manual strokes exerts a powerful influence on the central nervous system. The light touch stimulates mechanoreceptors in the skin, which sends signals to the brain that activate the parasympathetic branch of the autonomic nervous system, the biological state colloquially known as rest and digest. This parasympathetic activation counteracts the stress-induced sympathetic overdrive, causing heart rate to slow, blood pressure to normalize, and circulating cortisol levels to plummet. In this biochemically optimized state of deep relaxation, the brain is far better prepared to initiate and sustain the complex architecture of restorative sleep. Once an individual achieves deep sleep, Unobstructed by the physical torment of aching legs, the body can fully engage in its overnight repair protocols. This includes the fascinating process of autophagy, where cells systematically dismantle and recycle their own damaged organelles and misfolded proteins, a process that is highly dependent on a clean extracellular environment. Concurrently, while systemic lymphatic health is being addressed, it is vital to acknowledge the emerging science surrounding the brain's own waste clearance network, known as the glymphatic system. The glymphatic system operates almost exclusively during deep sleep, utilizing cerebrospinal fluid to wash away neurotoxic waste products, including amyloid beta plaques associated with Alzheimer's disease. While the manual drainage of the legs does not directly manipulate the brain's glymphatic system, the two are inextricably linked by the absolute necessity of high-quality, uninterrupted sleep. By eliminating the physical pain that fragments sleep architecture, the nightly ritual of leg lymphatic drainage indirectly but powerfully safeguards the brain's ability to cleanse itself, highlighting the profound systemic consequences of localized self-care. However, relying solely on mechanical manipulation to manage lymphatic health is an incomplete strategy. The underlying biological conditions that dictate the viscosity and volume of the lymphatic fluid must also be rigorously addressed through targeted nutrition and hydration. The lymphatic fluid is composed primarily of water, and its ability to flow smoothly through the microscopic vessels is entirely dependent on the hydration status of the individual. In the elderly population, the thirst mechanism often becomes blunted, leading to chronic, low-level dehydration. When the body is dehydrated, the blood volume drops, and the body reacts by releasing antidiuretic hormone and aldosterone, which signal the kidneys to aggressively retain sodium and water. Paradoxically, this retention often exacerbates swelling in the tissues, as the water is drawn out of the vascular space by the altered oncotic pressures and becomes trapped in the extracellular matrix. Furthermore, dehydration causes the lymph fluid to become highly concentrated and dangerously viscous, transforming from a free-flowing liquid into a thick, sluggish sludge that the weakened lymphatic pumps struggle to move. Therefore, maintaining optimal, consistent hydration throughout the day is a critical prerequisite for effective lymphatic function. The water consumed should ideally be rich in trace minerals, supporting the delicate sodium-potassium pump mechanisms that maintain cellular membrane potentials and fluid balance. The nutritional composition of the diet also plays a monumental role in the integrity of the lymphatic vessels and the generation of the toxic metabolic waste that accumulates in the legs. A diet high in ultra-processed foods, refined carbohydrates, and unhealthy trans fats fuels the production of advanced glycation end products and a flood of free radicals. These highly reactive oxygen species cause immense oxidative stress, directly damaging the delicate endothelial cells lining the lymphatic capillaries and promoting a state of systemic hyperpermeability, where fluid leaks excessively from the blood vessels into the tissues. Conversely, a diet structured around anti-inflammatory, nutrient-dense whole foods can dramatically fortify the lymphatic infrastructure. High intakes of colorful vegetables and dark berries provide a wealth of polyphenol and flavonoids, potent botanical compounds that have been scientifically demonstrated to strengthen capillary walls, reduce vascular permeability, and enhance the spontaneous contractility of the lymphangins. Foods rich in omega-3 fatty acids, such as wild-caught salmon, walnuts, and chia seeds, are essential for synthesizing anti-inflammatory prostaglandins, which directly counteract the inflammatory cytokines pooling in the lower extremities. Additionally, adequate intake of high-quality protein is necessary to maintain proper levels of serum albumin. Albumin is a major blood protein responsible for generating the oncotic pressure that keeps fluid inside the blood vessels. When dietary protein is deficient, serum albumin drops, and fluid relentlessly leaks into the tissue spaces, exacerbating dependent edema. Incorporating natural diuretics and circulatory stimulants, such as parsley, dandelion root, ginger, and turmeric, can also provide systemic biochemical support to assist the mechanical drainage efforts. Integrating these profound dietary adjustments creates an internal biochemical environment that resists fluid accumulation and supports the rapid, efficient clearance of waste. Beyond nutrition, the physical lifestyle habits maintained throughout the waking hours inevitably dictate the severity of the lymphatic congestion that must be addressed at night. The lymphatic system, lacking a central pump, evolved to rely heavily on the contraction of surrounding skeletal muscles to propel fluid upward. The gastrocnemius and soleus muscles of the calf are frequently referred to as the body's second heart, because their powerful contractions during walking forcibly squeeze the deep veins and lymphatic vessels, propelling blood and lymph against gravity toward the torso. In modern, sedentary lifestyles, particularly among older adults who may face mobility challenges, this vital muscle pump is largely inactive for hours at a time. Sitting in a chair with the legs bent at a 90-degree angle not only deactivates the calf pump but also creates a physical kink in the major lymphatic and venous vessels at the groin and behind the knee, creating an enormous mechanical impedance to upward flow. To mitigate this daily accumulation, it is crucial to incorporate frequent, low-impact movements throughout the day. Simple practices such as performing seated heel raises to engage the calf muscles, flexing and pointing the toes, and taking short, frequent walks can prevent the fluid from deeply settling into the tissues. When sitting for extended periods cannot be avoided, elevating the legs above the level of the hips is an incredibly effective biomechanical strategy. Elevation utilizes the very force of gravity that normally causes swelling to instead drain the fluid backward toward the central circulation. Furthermore, the strategic use of graduated compression garments during the day provides continuous, external counterpressure to the legs. This firm, elastic pressure prevents the superficial veins and lymphatic capillaries from overexpanding under the weight of the fluid, forcing the fluid into the deeper, larger transport vessels and significantly reducing the sheer volume of toxic stagnation that needs to be manually cleared before sleep. The psychological dimensions of chronic fluid stagnation and the subsequent implementation of a self-care routine must also be deeply analyzed, as the mind-body connection in the elderly profoundly influences physiological outcomes. Chronic pain, swelling, and the resultant loss of mobility often breed a pervasive sense of physical vulnerability and a loss of bodily autonomy. When an older adult looks down at swollen, discolored legs, it can serve as a distressing visual reminder of aging and physiological decline, frequently leading to feelings of depression, anxiety, and a withdrawal from social activities. This psychological distress is not merely an emotional reaction. It has concrete physiological consequences. The brain processes emotional distress by activating the hypothalamic pituitary adrenal axis, resulting in the continuous release of stress hormones that exacerbate systemic inflammation and constrict blood vessels, thereby worsening the very lymphatic congestion that caused the distress in the first place. Teaching older individuals the precise, scientific techniques of manual lymphatic drainage empowers them to take active, tangible control over their own biological processes. The nightly ritual shifts from a time of dreading pain and sleeplessness to a dedicated, mindful period of therapeutic self-healing. As they actively feel the tissue softening beneath their fingertips and experience the immediate relief of pressure and pain, a profound psychological shift occurs. The individual reclaims a sense of agency, transforming from a passive victim of gravity and aging into an active participant in their own longevity and cellular health. This empowerment lowers psychological stress, downregulates the sympathetic nervous system, and fosters a positive biochemical feedback loop that enhances the efficacy of the physical drainage. By recognizing the intricate interplay between anatomical structure, fluid dynamics, cellular biochemistry, dietary influences, and psychological state, we realize that moving fluid out of the legs is not an isolated task, but a deeply integrated process of whole-body restoration. The nightly practice of sweeping toxic, stagnant metabolic waste out of the delicate capillary beds of the feet, through the calf muscle pumps, past the critical junctions of the knees and groin, and back into the purifying flow of the central circulation is an act of profound physiological respect. It is an acknowledgement that the body's natural filtration systems, though perhaps slowed by the passage of time, remain exquisitely responsive to mindful, targeted intervention. Through the gentle, rhythmic upward strokes applied each night, we are not simply reducing a cosmetic swelling. We are actively rescuing millions of cells from a hypoxic, anti-inflammatory environment, preserving the structural integrity of the connective tissues, protecting the delicate peripheral nervous system from chemical irritation, and setting the stage for the deep, restorative sleep that is the ultimate foundation of health, vitality, and graceful aging. The comprehensive mastery of this self-care technique represents a profound synthesis of scientific knowledge and practical application, offering a powerful, accessible tool to fundamentally elevate the trajectory of aging and ensure that the golden years are not defined by stagnation and discomfort, but by cellular resilience, vibrant energy, and a restored harmony within the magnificent complexities of the human body.